I am Dr. Vera Barbosa, and I am a specialist. What differentiates, to me, the care we give to kids than we give to adults? Everybody's deserving of great care. What differentiates, though, it's just the emotional environment that surrounds the kids as, as patients. It's the beginning of a life. The expectation of those parents is that life is going to be a happy, healthy life. That's why you have kids. You want, to make more people happy. And then at some point, if they are ill, everybody, the whole environment, the whole family, gets involved with it. That everybody wants the best outcome. Everybody wants to give them the best opportunity and the best care. And it's really rewarding to be part of that, which is not only the clinical care of the life, but it's like the dream, of the whole family. And to be able to help that to happen and to be part of it is very gratifying. The way we see anesthesia, a lot of people don't see the anesthesiologist with the patient. But that's not how we see it. And I guess that's why we do it. Because the surgeon, he sees the patients on a regular basis. I'm not talking about the trauma situation, but on a regular basis, you go to the doctor, you go to the office, you decide that you're going to have surgery, you plan, you discuss, and then it happens. So there is a time to build up a relationship. So that relationship gets more intense within that period of time. For us, we have very short time to make that first to that first encounter with the patient, but it has to be very intense. It is going to be very intense because for the parent, he's gonna give his baby to me, and I'm gonna take that baby who's awake, might be ill, he's awake, to a near-death situation with the commitment to bring the kid back and give it back to you. That's what we do, So for us, it's every single one it's not a very long relationship, but it's very intense. Because what we're gonna cause to the kid, we're gonna take that kid to a situation where the surgeon can do that wonderful job that he's gonna do, but if there was no anesthesia, it would kill the kid. So we're gonna keep the kid amenable to that procedure in a safe way, but with the commitment to bring that kid back and give it to you. And at that moment, at that period of time, we as a norm, we forget even our kids. When we are in the OR with a patient, you don't think of anything else. That's where you're at. That's what you do. The whole world, vanishes. That's the most important thing for you is that kid over there. And that's why that's why it's so, each patient requires a lot of this commitment. It's extremely, it's like a privilege. It's not a license given right. It's a privilege to us when a parent renders, a kid to us so we can take care of. That's how we feel about it. I think that when we are giving a service to a kid as a doctor or to a young adult as in the beginning of their career, a young doctor, the similarity is the phase of their lives when we encounter them. We encounter the kid at the beginning of their life, their development as a person, and we encounter these young doctors in the beginning of their career, the development of their career. So I think that any interaction with them is going to have an impact, because it's such a beginning, of the whole path that they have ahead of them. And since we know that we are at the beginning and we're going to have an impact on how they're going to evolve, what they're going to turn out to be, it becomes very important, to me, that that's a good impact. And it's what brings them together, in my point of view, as far as the service that I'm, giving to them. It's the fact that it's their beginning, and we want to be a positive impact at that point of their lives. I think that there is a nice quality that I see here, children's, which is the fact that everybody that I've met here wants to be here and wants to have the best to give to these patients.